There is a habit you perform every single day, perhaps dozens of times a day, that could be a quiet signal of profound danger within your body. It's not smoking. It's not eating junk food. It is the simple, unconscious act of dismissing a message from your own heart. It's the habit of saying, "I'm just tired," when an unshakable fatigue settles into your bones. It's the habit of thinking, "I'm just getting older," when you pause for breath halfway up a familiar flight of stairs. It's the habit of fluffing up another pillow at night and telling yourself, "It's just more comfortable this way," without asking why your body suddenly needs to be propped up to breathe. For over 25 years as a physician, I have seen the devastating consequences of this one habit. It's a habit of rationalization, of making excuses for a body that is desperately trying to send you a warning. These aren't just random H's or signs of aging. They are whispers, and these whispers, if you ignore them, will eventually become a roar, a medical emergency that could have been prevented. Today, we are going to break that habit. We will turn down the noise of daily life and learn to listen to the critical signals your heart is sending you. We are going to explore 13 early signs of heart failure that hide in plain sight, disguised as the normal burdens of a busy life. By the end of our time together, you will no longer be an unwitting participant in this dangerous habit of dismissal. You will be an empowered guardian of your own health, armed with the knowledge to act, not out of fear, but out of wisdom. Let's begin this journey together. Our first sign is the one most commonly mistaken for being out of shape: shortness of breath during activities that once felt effortless. I'm not talking about the breathlessness after a vigorous run or an intense workout. I am talking about the kind of breathlessness that ambushes you during the mundane moments of your life. When you're carrying a bag of groceries from your car to the kitchen. When you're walking to the mailbox at the end of your driveway. Or when you climb that same flight of stairs you've climbed 1,000 times before. But this time, you have to stop at the top, leaning against the wall. Your chest heaving. This is a phenomenon doctors call exertional dyspnea, and according to the American Heart Association, it is one of the earliest and most prevalent distress signals of a struggling heart. Let's visualize what's happening inside your body. Think of your heart as the powerful, central engine of a sophisticated machine. This engine's primary job is to pump oxygen-rich blood to every part of your body, fueling your muscles for movement. When you begin an activity, your muscles send out an immediate request: more fuel, more oxygen. A healthy heart responds instantly, increasing its pumping force to meet that demand. But in the early stages of heart failure, that engine is beginning to weaken. It can't generate the same power. So when your muscles call for more oxygen, the heart strains but can't keep up. The result? Your lungs, the body's support system, go into overdrive. They work furiously to pull in more air, trying to compensate for the oxygen deficit. This frantic effort is what you experience as a distressing shortness of breath. The key distinction you must recognize is the progression. It's not about one single event. It's about a pattern. It's when you notice that your personal baseline for activity has insidiously shifted. If a walk around the block used to be a pleasure and now feels like a chore, that is a signal. If you find yourself subconsciously choosing the elevator over the stairs, that is a signal. This isn't just a sign of aging. It is your heart's cry for help, a fundamental indication that the supply of oxygenated blood is no longer meeting your body's demand. Acknowledging this change isn't a sign of weakness, it's the first, most crucial step in taking back control. Now, let's move from the moments of activity to the moments of stillness, specifically, the hours when you are supposed to be resting and recharging. The second warning sign is so subtle, so gradual, that most people adapt to it without ever questioning the underlying reason. It is the slow, creeping need for more and more pillows to breathe comfortably while you sleep. This condition has a medical name, orthopnea. It is a classic, telltale sign that your heart is struggling to manage the fluid in your body when you lie down. Imagine what happens when you are standing or sitting up during the day. Gravity is your heart's silent partner. It helps keep fluid pooled in the lower parts of your body, like your legs and ankles. But the moment you lie flat in bed, that partnership ends. Gravity is no longer assisting. All the fluid that was in your lower extremities is now free to travel back into your central circulation. For a healthy heart, this nightly fluid shift is no problem. It simply pumps the slightly increased volume of blood through your system efficiently. But for a heart that is weakened, this redistribution of fluid is like a sudden, overwhelming flood. The left side of the heart, which is responsible for pumping freshly oxygenated blood from the lungs out to the rest of the body, can't handle the surge. The pressure builds backward, like a traffic jam on a highway. This back pressure extends into the pulmonary veins, the vessels carrying blood from your lungs to your heart. When the pressure gets too high, a clear fluid begins to seep from these tiny blood vessels into the air sacs of your lungs. Your lungs are literally becoming waterlogged. And what is your body's instinctive reaction? It forces you to find a position that lets gravity become its ally once more. You might start by adding just one extra pillow. For a few weeks, that seems to work. Then, you find you need two. Soon, you might be folding a third pillow in half, creating a steep wedge. Eventually, many people I've spoken with abandon their bed altogether, finding that the only place they can get a decent night's sleep without feeling like they are suffocating is in a recliner, sleeping nearly upright. They tell their family, "Oh, I just sleep better in my chair." They rationalize this profound change as a simple matter of comfort or personal preference. But it is not. It is a critical adaptation to a failing biological system. If you have gone from sleeping peacefully on one pillow to constructing a fortress of pillows just to get through the night, your heart is sending you one of its clearest, most urgent messages. It's a message you can't afford to ignore. If this specific sign resonates with you, please consider sharing a simple yes in the comments. Your experience is valid, and letting others know they are not alone can be incredibly powerful. This brings to our third, and perhaps most terrifying, sign. It is the nocturnal cousin of the previous symptom, but far more dramatic and frightening. It's called paroxysmal nocturnal dyspnea, or PEND. Imagine this: you have been asleep for a few hours, deep in slumber. Suddenly, you are violently jolted awake. You are not just short of breath, you are gasping, fighting for air with a terrifying sense of panic, a primal feeling of drowning. Your heart is pounding in your chest, and an overwhelming instinct forces you to sit bolt upright, or even leap out of bed and stumble towards an open window, desperate for a gulp of fresh air. This harrowing experience is a hallmark of advancing heart failure. The mechanism is similar to orthopnea, but represents a more severe breakdown in your heart's ability to cope. As you lie asleep for an extended period, the fluid that has been slowly seeping into your lungs reaches a critical tipping point. The air sacs become so congested that the exchange of oxygen is severely impaired. Your brain's survival centers recognize this life-threatening drop in oxygen and trigger a massive adrenaline surge to wake you up, forcing you to change position immediately. Clinical studies show this terrifying event typically happens 2 to 4 hours after falling asleep. The relief upon sitting or standing up is usually quite rapid, but the sense of fear and anxiety can linger for a long time, making you afraid to go back to sleep. What makes this symptom so perilous is how easily it is misdiagnosed. both by patients and sometimes even by healthcare providers. People often attribute these episodes to a severe nightmare, a panic attack, or a common condition like sleep apnea. And while those conditions can certainly disrupt sleep, the specific pattern of PEND is unique, waking suddenly from a deep sleep with an intense, smothering sensation that is only relieved by sitting or standing up. If you have had an experience like this, even just once, it is not something to be explained away. If it has happened more than once, it is an unequivocal alarm bell. Your body is not overreacting, it is screaming for help. This is a symptom that warrants immediate medical evaluation, without delay. The fourth warning sign is one of the most insidious because it masquerades so perfectly as a normal part of life. It's a profound and overwhelming fatigue that drains the color from your days and turns simple tasks into monumental efforts. This is not the ordinary tiredness you feel after a poor night's sleep or a stressful week at work, a tiredness that a good rest can cure. This is a persistent, bone-deep exhaustion that clings to you no matter how much you sleep. It is the feeling of walking through wet cement, where every step requires a conscious act of will. When your heart begins to fail, it enters a state of crisis management. Your body, in its infinite wisdom, initiates a process of triage. It starts to divert the limited supply of oxygen-rich blood away from what it deems less critical areas and redirects it towards the most vital organs, your brain and your heart itself. This means your skeletal muscles in your arms, your legs, your back are put on a strict ration. They receive less fuel, less oxygen, and as a result, they cannot function at their normal capacity. This is the source of that profound weakness and fatigue. Studies have shown that this debilitating symptom can appear months, sometimes even a year, before more dramatic signs like swelling or severe breathlessness become apparent. What is particularly telling is how this fatigue systematically dismantles your exercise tolerance. You might notice that your recovery time has changed dramatically. A brisk walk that once left you feeling refreshed and energized now leaves you feeling wiped out for hours. Simple daily routines become grueling ordeals. Carrying laundry up the stairs, vacuuming the living room, or even taking a shower can feel as exhausting as running a marathon. The progression is often so slow and deceptive that you begin to unconsciously adapt your entire life around it. You start turning down social invitations. You stop tending to your garden. You make excuses, blaming your age, the weather, or stress. You shrink your world, bit by bit, without ever realizing that the cage you're rebuilding is being constructed by a struggling heart. This progressive loss of stamina, this ever-dwindling reserve of energy, is not a normal part of aging. It is a direct physiological consequence of your body's engine failing to provide the power needed to live your life fully. Recognizing it for what it is, a critical warning sign, is the first step toward reclaiming your vitality. From the invisible feeling of fatigue, we now turn to one of the most visible and concrete signs of heart failure, swelling in your ankles, feet, or legs. This is known medically as peripheral edema. I want you to understand that this is not the minor, temporary puffiness you might experience after a long flight or sitting at a desk all day. This is a persistent, often progressive swelling that tends to be worse at the end of the day and improves overnight, only to return again the next afternoon. Let's break down the two primary reasons this happens. First, as we've discussed, a weakened heart doesn't pump blood as forcefully. This creates a backup in your circulatory system. Blood returning to the heart from your lower body has to fight against gravity, and when the heart's pumping action is weak, this blood flow becomes sluggish and begins to pool in your veins, particularly in your legs and feet. This increased pressure inside the veins forces fluid to leak out into the surrounding tissues. The second part of the problem involves your kidneys. Your kidneys are exquisitely sensitive to blood flow. When they sense a decrease in blood flow from the failing heart, they misinterpret this as dehydration. In response, they activate a hormonal alarm system that tells your body to hold on to sodium and water, to conserve fluid. This double whammy: sluggish circulation pushing fluid out of your veins and your kidneys holding on to excess salt and water creates the perfect storm for edema. Research published in leading cardiology journals indicates that this kind of swelling is present in approximately 70% of heart failure patients at the time of their diagnosis. It typically begins in the feet and ankles because they are the furthest points from the heart and most subject to gravity. Over time, it can creep up into the calves and even the thighs. You might notice telltale signs: your socks leave deep, painful indentations around your ankles that last long after you take them off. Your shoes, which fit perfectly in the morning, feel tight and constricting by evening. Rings that once spun freely on your fingers now feel snug. A key characteristic of heart failure-related swelling is that it is usually symmetrical, affecting both legs more or less equally. Another classic sign is pitting edema. If you press your thumb firmly into the swollen area for a few seconds and it leaves a distinct indentation, or a pit that slowly fills back in, it is a strong indicator that excess fluid is trapped in your tissues. Please do not dismiss this as a simple cosmetic issue. It is a physical manifestation of a serious internal imbalance. Now for what is arguably the most objective and measurable early warning sign: we have rapid and unexplained weight gain. I am not referring to the gradual weight gain that occurs over months from changes in diet or exercise. I am talking about a sudden, alarming jump on the bathroom scale, a change that can happen in just a matter of days and should trigger immediate concern. The guidelines from the American Heart Association are very specific and clear on this point: a weight gain of 2 to 3 pounds in a single 24-hour period, or 5 pounds or more in 1 week, warrants an urgent call to your healthcare provider. This rapid increase in weight has nothing to do with fat. It is purely the accumulation of excess fluid, the same fluid that causes the peripheral edema we just discussed. As your heart fails, it sets off that hormonal cascade that signals your kidneys to retain salt and water. This fluid builds up throughout your entire body, not just in your legs. For every kilogram or 2 pounds of weight you gain, your body is holding onto approximately 1 liter of extra fluid. This is why cardiologists often instruct their heart failure patients to weigh themselves every single morning, at the same time, after using the restroom, but before eating. It acts as a sensitive, early warning system that can detect a worsening of their condition long before symptoms like severe breathlessness land them in the hospital. The scale does not lie. You might not feel significantly more swollen yet. Your breathing might only feel slightly more labored. But a sudden upward trend on the scale is an undeniable piece of data that something is wrong. The weight gain associated with heart failure feels different from normal weight fluctuations. It's often accompanied by a feeling of bloating, tightness in your clothes, or a generalized sense of fullness, as if you are a water balloon being filled beyond your capacity. It is a consistent, relentless upward climb. If you notice this pattern, it is one of the most compelling reasons to seek medical attention promptly. It provides your doctor with concrete evidence that can guide diagnosis and treatment. Our 7th sign is one that frequently puzzles people and is often attributed to other causes, particularly aging. It is the sudden and disruptive need to urinate more frequently at night. The medical term is nocturia. This isn't just about waking up once during the night. This is about a distinct shift where you may find yourself getting up 3, 4, or even 5 times per night to use the bathroom, disrupting your sleep and leaving you exhausted in the morning. The physiology behind this is a direct consequence of the fluid shifts we've been discussing. During the day, while you are upright and active, gravity pulls excess fluid down into your legs and lower tissues. Your struggling heart and compromised circulation can effectively return this fluid to your kidneys to be processed and eliminated. So, it sits there, trapped in your lower body. But when you lie down to go to sleep, the game changes. Gravity's influence is neutralized. That large volume of fluid that was pooled in your legs is now free to re-enter your bloodstream. Your kidneys, which were relatively underworked during the day, are suddenly hit with this massive fluid load. They sense the surge and kick into high gear, working overtime all night long to filter this excess fluid and produce urine. This is why patients often report that the volume of urine during these nighttime trips is surprisingly large. Research has shown that nocturia can be one of the very first signs of heart failure, sometimes appearing months before more widely recognized symptoms like swelling or orthopnea. The pattern is the key. It's not just about frequency, it's the reversal of the normal day-night cycle of urination. If you notice that you are producing significantly more urine at night than you are during the day, please do not simply write it off as an inevitable part of getting older or blame it on that glass of water you had before bed. It could be a subtle but profound clue that your heart and kidneys are struggling to manage your body's fluid balance. If this is something you've been experiencing, it is absolutely worth discussing with your doctor. Closely related to the nighttime fluid shifts is our 8th warning sign, a persistent, nagging cough or wheeze that mysteriously appears or worsens only when you lie down. This is not the deep, productive cough you get with a cold or bronchitis, nor is it the dry, tickly cough of allergies. Patients often describe it as a frustrating, dry, hacking cough that starts soon after they lie down, interrupts their sleep, and miraculously improves once they sit up. This nocturnal cough is triggered by the very same mechanism that causes orthopnea and PEND. As you lie flat, fluid redistributes from your lower body. A small amount of this fluid can congest the blood vessels in your lungs, creating a state of mild pulmonary congestion. Your airways are incredibly sensitive to this type of fluid buildup. Your body's natural reflex is to try and clear this perceived obstruction, so it triggers a cough. It's an attempt to expel something that isn't really there in the traditional sense. Sometimes, this congestion can also cause the small airways to narrow slightly, producing a faint wheezing sound, similar to mild asthma. Medical literature often refers to this as a cardiac cough. A key feature is that it typically produces little to no phlegm. However, in some cases, patients may cough up a small amount of thin, white or pink-tinged frothy sputum. This is a very significant sign, as it indicates that fluid has indeed crossed from the blood vessels into the air sacs themselves. What makes this symptom so dangerously deceptive is the number of common, benign conditions it mimics. People almost always blame it on something else: a post-nasal drip, acid reflux GERD, allergies to dust mites in their pillows, or simply a dry bedroom environment. They try cough suppressants, allergy medications, and humidifiers, all with little effect, because they are treating the wrong problem. If you have a persistent cough that plays by these specific rules, it appears at night, gets worse when you lie flat, and gets better when you sit up, you must consider the possibility that it is not coming from your throat or sinuses, but from your heart. From the lungs, we now turn our attention directly to the engine itself. Our 9th sign involves changes in your heart's own rhythm. The sensation of palpitations, feeling your heart fluttering, racing, pounding, or skipping beats can be a deeply unsettling and early warning of heart failure. These irregularities often arise as your heart muscle works harder and harder to compensate for its weakening state. When the heart's main pumping chambers, the ventricles, become enlarged or strained, it can disrupt the intricate electrical pathways that coordinate your heartbeat. This can lead to a variety of irregular rhythms, known as arrhythmias. You might feel a sudden, rapid-fire beating in your chest even when you are sitting quietly, reading a book. You might experience the disturbing sensation of a skipped beat, which is often followed by an uncomfortably forceful thump as the heart gets back on track. Some people describe it as feeling like a fish flopping around in their chest, or their heart doing somersaults. It's important to understand that the relationship between arrhythmias and heart failure is a two-way street. An irregular, rapid heart rhythm like atrial fibrillation can, over time, weaken the heart muscle and actually cause heart failure. Conversely, a heart that is already failing is an irritable heart, making it much more prone to developing dangerous arrhythmias. This can create a vicious cycle where each condition makes the other worse. These palpitations are often more noticeable when you are at rest or lying down, simply because there are fewer distractions and you are more attuned to your body's internal sensations. They can be accompanied by a wave of anxiety or a general sense of unease, which is a natural response to such an alarming physical feeling. While it is true that palpitations can be caused by many things, including stress, caffeine, or anxiety, they should never be dismissed out of hand. When they occur in concert with other symptoms on our list, like fatigue or shortness of breath, they form a compelling piece of evidence that your heart is under significant strain and requires a thorough medical evaluation. The information you can provide your doctor about when they happen, what they feel like, and how long they last is incredibly valuable. So, if this has been happening to you, a great first step is to start keeping a small journal of these episodes. And if you've ever felt that fluttering sensation, consider hitting the like button on this video. It's a silent way of acknowledging this shared, and often frightening, experience. Our 10th sign involves your brain. Episodes of dizziness, lightheadedness, or feeling like you are about to faint can be profoundly frightening, and they are important early indicators of heart failure. These symptoms arise because your weakened heart is unable to pump a sufficient volume of blood to maintain adequate circulation and blood pressure to your brain, particularly during changes in position or with physical exertion. Under normal circumstances, your body has a sophisticated system to manage blood pressure. When you stand up quickly from a sitting or lying position, gravity pulls blood downward. Your body instantly compensates by constricting blood vessels and slightly increasing your heart rate to ensure your brain continues to receive a steady flow of oxygenated blood. However, a failing heart simply doesn't have the strength or responsiveness to make these rapid adjustments effectively. As a result, when you stand up, your blood pressure can momentarily plummet, leading to that dizzy, lightheaded feeling, or seeing stars. In more severe cases, it can lead to a brief loss of consciousness, known as syncope or fainting. Clinical studies show that syncope occurs in about 20% of heart failure patients and can be one of the earliest presenting symptoms, sometimes appearing before the more classic signs of fluid retention. These episodes are often triggered by very specific actions: standing up too quickly, standing still in one place for a long period like in a checkout line, or even mild exertion that would have been trivial before. What makes this symptom so hazardous is not just the risk of falling and injury, but also how commonly it is attributed to other causes. People blame it on dehydration, a side effect of medication, low blood sugar, or inner ear problems. And while all of those are valid possibilities, when dizziness or near fainting occurs alongside increasing fatigue or breathlessness, it points strongly towards a cardiovascular cause. It suggests that your heart's output has diminished to the point where it is struggling to meet the basic metabolic needs of your most vital organ, your brain. Now, let's explore an area that might seem completely unrelated to the heart, your digestive system. Our 11th sign is a cluster of symptoms including persistent abdominal bloating, a loss of appetite, or a feeling of being full after eating only a very small amount of food. These gastrointestinal issues can be early and very bothersome signs of heart failure, yet they are almost universally overlooked because they don't seem like heart problems. When your heart's pumping function declines, it impacts your entire circulatory system, including the blood supply to your digestive organs. The gastrointestinal tract receives less oxygen-rich blood, which can slow down the entire process of digestion. More importantly, just as fluid can back up in your lungs and legs, it can also back up in your abdomen. This condition, called ascites, is a buildup of fluid in the abdominal cavity. Furthermore, the liver can become severely congested with blood that the right side of the heart is failing to pump forward effectively. This is known as congestive hepatopathy. This combination, a sluggish digestive system, fluid in the abdomen, and a swollen, congested liver creates a cascade of uncomfortable symptoms. Patients often report feeling uncomfortably full after just a few bites of a meal, a condition known as early satiety. They might experience persistent nausea or a constant, nagging bloated feeling that isn't relieved by antacids or other digestive aids. The liver congestion can cause a dull ache or a feeling of pressure in the upper right quadrant of your abdomen. Some people describe it as a constant sense of fullness in their belly that makes the very idea of eating unappealing, leading to unintentional weight loss over time. Because these symptoms are so closely associated with digestive disorders, both patients and doctors can be led down the wrong path, investigating the stomach or liver without considering that the root cause is actually a failing heart. It is a powerful reminder that your body is an interconnected system, and a problem in one area can manifest in the most unexpected places. Our 12th sign is so specific, so peculiar, that it wasn't even given a medical name until 2014. Yet, it has proven to be a remarkably reliable early indicator of high pressures inside the heart. The symptom is called Bendopnea. This is defined as shortness of breath that occurs within 30 seconds of bending forward. For example, when you lean over to tie your shoes, pick something up off the floor, or bend over the sink to wash your face. The discovery and characterization of Bendopnea in the medical literature was a significant breakthrough. Researchers found that this simple, observable symptom is a highly specific marker for elevated cardiac filling pressures. Let me explain what that means. When you bend forward at the waist, you are physically compressing your abdomen. This increases the pressure within your abdominal cavity, which in turn pushes up on your diaphragm and increases the pressure within your chest. For a healthy person, this momentary increase in pressure is insignificant. But if your heart is already struggling with high internal pressures because it's having trouble relaxing and filling with blood, this added external stress is the straw that breaks the camel's back. It triggers an almost immediate sensation of breathlessness. Studies published in prestigious cardiology journals, like the Journal of the American College of Cardiology, have found that Bendopnea is present in nearly a third of patients with advanced heart failure. More importantly, its presence is strongly associated with a more severe disease state and a higher risk of mortality. In essence, this simple physical sign acts as a kind of poor man's stress test. It provides a non-invasive clue that the pressures inside your heart are dangerously high, something that would otherwise require sophisticated and invasive testing to confirm. What makes Bendopnea so critically important is its specificity. While shortness of breath with activity can have many causes, shortness of breath that is reliably triggered within seconds of bending forward is almost exclusively a sign of a cardiac issue. If you have noticed this very specific symptom in your own life, it is a powerful piece of information to share with your doctor. It is not a sign you are inflexible or out of shape. It is a direct communication from your overburdened heart. Finally, we arrive at our 13th warning sign, which involves subtle changes in your circulation that you can see and feel in your own extremities. Persistently cold hands and feet, even in a warm environment, can indicate that your heart isn't pumping with enough force to maintain adequate blood flow to the periphery of your body. As heart failure develops, your body engages in that vital triage process we discussed earlier. It shunts blood away from the extremities, your hands, feet, and skin to preserve flow to the critical organs, the heart and brain. This can leave your hands and feet feeling perpetually cold to the touch, sometimes even taking on a pale or slightly bluish tinge, a condition known as cyanosis. You might notice that it takes them an unusually long time to warm up after being cold, or that they feel cold even when the rest of your body is comfortable. A more subtle, but very important, circulatory sign is something called a narrow pulse pressure. This is something you would need a blood pressure cuff to measure. Your blood pressure reading has two numbers. The top number is the systolic pressure, the pressure when your heart beats. And the bottom number is the diastolic pressure, the pressure when your heart rests between beats. The difference between these two numbers is your pulse pressure. For example, if your blood pressure is 120/80, your pulse pressure is 40. Normally, this number should be 40 mmHg or more. When the pulse pressure narrows significantly, for instance, a blood pressure of 110/90 gives a pulse pressure of only 20, it can be a sign of reduced stroke volume. This means your heart is not ejecting a sufficient amount of blood with each beat. The failing heart muscle is too weak to generate the forceful contraction needed to create a healthy difference between the systolic and diastolic pressures. Medical research has shown that these circulatory changes often develop very gradually and can be early red flags of a decreasing cardiac output. They are the external signs of an internal power failure. If you have recognized yourself in one, or perhaps several, of these 13 warning signs, I want you to take a deep breath. The purpose of this information is not to cause panic, but to replace fear with knowledge. Heart failure, especially when it is identified in these early stages, is a manageable condition. The absolute key is to break that habit of dismissal, to recognize these subtle signals for what they are, and to take decisive action before a crisis occurs. The most critical thing to remember is that these symptoms rarely appear overnight. They creep in, they progress slowly, and they are masters of disguise. It is so easy to blame them on age, stress, or a dozen other things. But when you see a pattern, when familiar activities become inexplicably difficult, when your body just doesn't feel right in a way you can't quite put your finger on, that is the moment to listen. That is your heart telling you something vital. Early detection and treatment can dramatically alter the course of this disease, improving not just your longevity, but your quality of life. Modern medicine offers an incredible arsenal of tools to help manage heart failure, from medications that can help your heart pump more strongly and efficiently, to lifestyle changes that are so powerful they can slow, or in some cases, even reverse the progression of the disease. You hold so much power in your own hands, the power to notice, the power to question, the power to seek help. Thank you for taking this time to invest in your health, to learn the language of your heart. If you found this information valuable, please consider subscribing to the channel and sharing this video with someone you care about. it could truly be a life-saving conversation. Take charge of your heart health. You deserve a future filled with vitality and joy.